Hi, Governor. I was just curious. Right now, the Virginia website is not releasing recovery numbers, and as that peak is starting to flatten out in some parts of the country, would you look into putting recovery numbers on the website so we could see how this gets better? And then obviously also that doesn't mean necessarily that we need to stop social distancing, so but at least we could maybe see those numbers start to come down.
If I understood the question, it was why is it that we are not posting recovery numbers on the VDH site? That data actually is not collected for us and reported to us in order for us to then be able to display it on the site. We get positive cases, and we know when those positive cases are either discharged or in the unfortunate circumstance of their passing away. We know that as well. We aren't able to track the other folks with COVID-19. Also, the other thing you should realize here is that those numbers in and of themselves are almost definitely an underestimate of the actual spread of the disease in the community. We have been talking for some time now about the fact that we have widespread transmission of the disease. There are many people who have COVID-19 who are walking around in our community, and this is the reason why social distancing is so important. And we don't track those numbers either because we don't have widespread testing.
Just to clarify for that point, so are the number of hospitalizations on the website, is that current or is that cumulative? Like, will that number go down as people are discharged? And then my further question afterwards is, I know last week we talked about expectations of this arriving in May. The Washington State IHME website is now showing the peak April 20th. I know you're working with UVA to develop one. Can you speak as to where that one stands and what you all are seeing and predicting at this point?
The hospitalization numbers that we have on the VDH site comes from the Virginia Health Information, that organization, and represents discharge information that comes as part of hospital claims. That number lags behind the number that you would get if you were to ask that same question of the Virginia Hospital and Healthcare Association, which actually tracks the current census in the hospitals. And I would encourage you to talk with them about that. And that number will change, obviously, every day as the census goes up and down. The models are changing all the time because the data on which those models are based changes from day to day. Yes, the University of Washington model has changed a good deal since the last week or so. We are currently working with our partners at UVA and expect to have a new report from them this week on that, and we can share that.
I might, if it's okay, Elena, just to follow up a little bit on the modeling and what Dr. Oliver said, how they change. And he also reminded us on Friday that this is not a perfect science. I just spent about an hour and a half with our vice president and all of the governors across this country. And we talked about that very issue of modeling. We also talked about PPE and a national supply chain that I think will be very helpful as we proceed. And also the testing, which we, again, are working to get toward a 15 to 30-minute turnaround, but we're not there yet. But the message, the reason I brought this point up, the message from our vice president, the message from Washington is to continue what we're doing, to continue the guidelines, the social distancing, the frequent hand washing, because that's what science tells us works. And if we can continue to do that, I think that we'll all as a country be able to defeat this pandemic.
The next question is from Daniela Treslow with WAMU.
Hi, it's good to be with you. I wanted to know about PPE. If you could please explain a little more about the $27 million contract with the Virginia company, and also for all of the representatives and officials up on the dais, why are none of you wearing masks if this is the recommendation? Thank you.
Let me address the second question, and then I'm going to have Secretary Moran. We all have masks, and when we exit the building, that's when we wear our mask, but when we're inside in our offices, we don't keep them on. But good, I appreciate the question, and I appreciate you putting the message out there that all Virginians, when you're out and about, we would encourage you strongly to use a mask, a face covering. Secretary Moran.
Thank you, Governor. The question is with respect to the purchase of personal protective equipment. As the Governor has reported on numerous occasions, we're woefully short. Numerous requests have been made of our strategic national stockpile, and we've received a mere fraction of what was requested. So, like other states, we have had to go to the market to find suppliers, and the help of many, particularly Secretary Lane and others, we've been able to identify what we believe to be a very reliable supply chain, and so a substantial purchase has been made. We expect that to be delivered by the weekend and distributed quickly thereafter. It will come in a number of receipts, and we will get that N95 masks that are in such great demand in our hospitals and nursing homes and first responder communities, as well as gloves and gowns and the other personal protective equipment that has been mentioned and is so vitally needed on the front lines. Thank you.
Following up on the PPE issue as well, is that a one-time order, and will that be consistent? And I was also wondering about Abbott rapid testing and whether the state has made efforts to secure that platform.
I'll let it was a promotion. Secretary Moran handle the PPE, and then I'll have Dr. Tony come up and talk about the testing.
On the PPE, with respect to that's a one-time purchase, no, we see that as the first of what will be many. Clearly, the need even outweighs what that purchase would be. I mean, we're anticipating a tremendous need for N95s in our hospitals. In fact, it was probably over a week ago that the governor went through what one patient requires in the ICU with respect to the PPE needs. So having heard that, I think that was a stark example of just how much PPE we need. So the purchase has been made. We made it with alacrity, but we're going to need additional supplies.
Thank you, Governor. I'll just address the issue with the Abbott rapid turnaround. Again, there's an installed base in Virginia in many urgent care centers and other care sites. The issue is the cartridges or the test kits that go with the analyzer. So we did get information that we are getting a handful of those, or in the 10 to 20 range, but not yet the number of test kits it takes to test adequately. That does have a less than 15-minute and sometimes less than 10-minute turnaround, which is fantastic, but we need the ability to do that at volume. So it's good that trickle is starting, but we need that to be a real torrent.
The next question is from Alan Rodriguez-Espinosa with BPM.
Hey, thank you. There's some new data coming out of Washington University that shows that the projected peak date for coronavirus cases in Virginia has moved up from May 20th to April 20th. So my question is, are you keeping an eye out on these numbers, and what are some adjustments that you're making to be more immediately prepared for what could be an earlier peak date than predicted?
The question is the data that is coming out on one particular model that shifts our surge to April the 20th, and I think we've made the point a couple times, there are various models. They change literally every day depending on the data that is put into them. And so we haven't made any adjustments by what we're seeing. We will certainly continue to follow the trends. And, if and when we need to make adjustments in our guidelines, we will certainly do that. But for right now, as I just reinforced, that's coming from the national level and also from us, continue to do what you're doing. The stay at home is working. The social distancing, the frequent hand washing, all of these things are effective. So keep doing the great work.
Will Virginia be sending any ventilators to New York as Oregon has done? And are you all considering entering into the consortium as Governor Newsom has suggested, so states aren't competing with one another for PPE?
That's a great question. The question is, are we sending supplies to New York or even other hot spots? You know, we were very proud just a week ago for the USS Comfort, which is docked in Norfolk, to go to New York and help out. And we are working with the other governors. We're working with our leadership in Washington to follow our inventory, not only in Virginia, but in all other states. But we also have a responsibility to prepare, and we have prepared for the worst. As I've always said, we hope for the best. So the PPE, the ventilators, our bed space, we are ramping all that up for a surge that we expect in a few weeks.
Tracy Agnew with the Suffolk News Herald.
Thank you, Governor. I'm sure you've seen the Politico article over the weekend that used models from Columbia University to pinpoint hotspots across the South, and localities like Suffolk and Isle of Wight County were mentioned in that. So I was wondering if there are any plans to continue looking at additional sites for increased hospital bed capacity across the state, particularly in Southampton Roads and some of the more rural areas to the west.
The question is, are we looking at other sites and as far as our surge capacity, our alternative sites? And we are looking at them. We're monitoring the data that is coming in from across the state. As of today, working with FEMA and working with the Corps of Engineers, we have identified the 3 sites, the one in Northern Virginia, one in Richmond, and one in Hampton Roads. And so as quickly as we can, we're going to get those 3 sites up and running.
Governor, Maryland's governor issued an order requiring all nursing home staff to wear PPE and to segregate infected patients. Are you interested in something similar to that? And then can you kind of give us a bigger picture of how you guys are dealing with the outbreaks at the long-term care facilities?
Yes, I'm going to let Dr. Oliver talk about the nursing homes and the requirements in the nursing home, but I did want to comment. I'm not sure why they didn't call on you first, Henry, because in here you're the only one that I see has face covering equipment, so I'm proud of you. So, Dr. Oliver.
So the question, as I understand it, is are we taking any special kinds of precautions or procedures, interventions with respect to long-term care facilities? The Virginia Department of Health has 35 districts across the Commonwealth, about 129 local health departments, and those local divisions of the health department are working very closely with the long-term care facilities in their area. The idea is to, as soon as we find a case in one of these facilities, we've done very extensive contact investigation and then worked with the administration of that long-term care facility to isolate the case and begin to ensure that none of the contacts are actually infected and protect the rest of the facility from that. I think that what we've seen in Washington State and unfortunately here in the Richmond area and Henrico, for example, is that if you don't get on that soon enough, you get a very wide, it's a population in which this infection can spread quite quickly. So I would say that what we're doing is we've stepped up our vigilance and surveillance in these facilities and worked more closely with them. And as the governor announced, we've also been very good about getting out PPE to these facilities as well.
The next question is from David McGee with the Bristol Herald-Courier.
Yes, thank you, Governor. A number of outdoor recreation venues here in Southwest Virginia, the Creeper Trails, Spearhead Trails, have closed in recent days, apparently in response to people not following the social distancing guidelines. We don't have a lot of cases in Southwest Virginia, but what's your message to folks who may think that maybe this doesn't apply to them just because we haven't seen a surge in cases in our area?
The question is, as far as recreational facilities like the Creeper Trail, Spearhead Trails out in the Southwest, and why do we continue to be worried about the Southwest? This virus it knows no borders, whether they be counties, states, even countries, as you all have seen. And so, I assume what happened, which is unfortunate, people weren't abiding by our guidelines, just as I warned about last week, and so the decision was made to protect everybody's health, that these facilities were closed. So I suspect that's what happened.
Going back to nursing homes, I'm wondering, well, two things. I'm wondering if the state would be willing to release the numbers of outbreaks that you've had at them. And also in talking to the health director for Henrico, Dr. Avula, who's been doing a lot of interviews about the Canterbury situation, he said two things there that they thought were really important was that they think that nursing homes should end the practice of sharing staff so that people aren't pulling a shift in one facility and then going to work at another. And he also said that even though testing has been in short supply, when they finally tested everybody in that facility, their eyes were really open to how many asymptomatic cases they had, and that led them to, segregate those folks. Are any of those things possibilities?
Could you repeat the very first question?
Can you release the numbers of outbreaks you've had at nursing homes or long-term care facilities?
I don't have that figure for you right now, but we could certainly take a look at that and I think be able to share that with you. The points that Dr. Avula raised, I think, are really very well taken. And part of what we're doing, and when I mentioned that we were intensifying our efforts around long-term care facilities, one of the things that we're trying to do is just those sorts of things. So if there's a case, doing more expansive testing within that facility to get a better idea of what the actual prevalence of the disease is in that facility. The nursing home workers are a very dedicated lot. People who know anything about long-term care facilities will know that they are not paid very well. I don't think it's so much a practice of the nursing home administrators as the need of these workers to have more than one job. And they tend to work in multiple facilities. Part of what we do in our investigations, for example, around this would be to, as part of the contact investigation, would be to trace that when workers go to another facility. And the other thing we've done is we've, in that situation, let the other nursing homes know about those index cases so that workers who are coming from there, they know that that might be a possible means of transmission and can increase their surveillance as well.
The next question will be from Neil Harvey with the Roanoke Times.
Good afternoon, Governor. Thank you. Can you address the question of why, despite the stay-at-home order, the state is allowing construction projects to continue, and specifically why there hasn't been a more restrictive approach that might allow only emergency construction projects that support essential infrastructure?
The question is, why are construction projects across Virginia to include buildings, and I suspect you're asking about road construction, why are they allowed to continue? And what we have done is made it perfectly clear that these businesses, whether they be road construction or building construction, are to adhere to the rules, 10 or less, to use the social distancing 6 feet apart. And to the best of my understanding, we haven't heard of any problems with that. So those were the guidelines that we initiated when we put out our executive order, and those will be continued. That we'll continue to follow them.
As far as there's a big number of cases in hospitals, according to the VHHA, where the results are still pending. You mentioned you're working towards this 15 to 30 minute turnaround in testing time, but I know in the past you've talked about how private labs are looking at more like 5 to 7 days. So can you speak to, is that still the case in terms of the lag on the private lab ends, and how is that impacting hospital capacity, and how that will affect it down the line?
Dr. Carey.
Thank you, Governor. I'll start. The question really is about, as we look at testing and not having widespread rapid turnaround testing, that a number of patients are in hospitals that have testing results pending. Okay, two things. One is that's where the in-house hospital labs that are becoming increasingly available at UVA, at Centera, the governor mentioned Centera, here at VCU, and also the state lab, that is one of the priorities, that folks who are in the hospital and have a lab pending. Now, there are still thousands of labs sent each day to the commercial labs, because it's still important to know whether they're positive or not, and those commercial labs are committed to getting those turnaround times quicker. It still is very helpful to know right away. So we've had folks in a hospital with a lab pending, but they send a sample to the state lab or to UVA, and they get it back in a day or a day and a half, and they're able to turn down the amount of personal protective equipment they're using on that patient. They have a viral syndrome. It's just not influenza, and it's not COVID-19. So it's important to have that testing because you get the results, but it's critically important for folks who are in the hospital to know if they have it, and especially if they don't have it, because they can decrease the contact precautions and all the PPE that the governor described last week.
But is it still fair to say that there are the private labs still experiencing that 5 to 7 day period? Has that shortened? I'm sorry if I missed it.
I don't believe it has shortened. I'll ask Dr. Tony, are there any additional elements that you'd like to share?
What I can say is that they are continuing to work through their backlog, and we have heard that there have been some reduction in their turnaround times, but what we've also seen in the Commonwealth is there have been a number of smaller private commercial laboratories that have stood up testing and are now offering testing for the Commonwealth. So there is a desire to coordinate testing and divert some of the hospital work to some of these new laboratories that now have a capacity and can share some of the testing burden. I think with respect to your second question about the testing that has a 15 to 30 minute turnaround time, as Secretary Carey mentioned, while these are not in place in Virginia, even when they do come in place, what we are struggling with is that the reagents and the cassettes that are needed to run these systems are not widely available. So even if hospitals get the instrumentation, the ability to scale up and run large numbers will still be a barrier to being able to use them widely for that quick point-of-care testing results.
WVTF Radio.
Yes, thank you, Governor. We now have 19 prison inmates and 9 staff with confirmed cases of COVID. Secretary Moran has stressed that by law, only a small number of about 30,000 convicts can be paroled. But you, as governor, have broad powers to pardon inmates. Some are seriously ill or disabled. There are others who've been wrongfully convicted or are scheduled for release within the next year. And then there are fishback prisoners or people who committed crimes as juveniles who will be eligible for parole on July 1st. My questions: could you issue an executive order to have that last group considered sooner? Have you assigned additional staff to review pardon requests? And how many people have you pardoned since COVID hit?
I appreciate the questions. I'm going to let Secretary Moran handle some of it, but I just want to say that we have a protocol that we work through with parole, and my folks are working around the clock. A number of individuals have been released, and we'll continue to work around the clock. But we have to follow our protocol, and as far as an executive order, I don't plan on releasing an executive order. But Secretary Moran, do you want to comment any more on how you all are doing? Thanks.
the question with respect to parole eligibility for one, and actually parole eligible are not 30,000. We are responsible for 30,000 inmates, but actual geriatric parole and pre-1995, when parole was abolished, it's actually only about 2,300. I think it's 2,351. So, and of those, as you know from our last week's one of the press conferences, the Parole Board has been working overtime to review those cases in light of the COVID-19 crisis. 95 were released in the month of March, just in the month of March, and that was a significant increase, 153% from the previous month. The challenge now is of the geriatric and the pre-95, about 90 to 95% are incarcerated for violent offenses. So that is why early on in this crisis, the governor provided strong recommendations with respect to addressing the jail population by using a variety of opportunities with summonses and early release and alternatives to incarceration, electronic monitoring. Two other factors in that is we have been contacted by some advocate groups. We had a really good call on Friday with advocates and family members, and that by statute we can release inmates 30 days prior to the official release date. That actually is already embedded in their release date, so we have been doing that all along. And fourth and finally, with respect to the governor's clemency powers, many in this room all remember the Howell versus McAuliffe case. Laura, you must remember that case. When the governor wanted to give a blanket restoration of rights for 200,000 felons. And he was sued, and the Supreme Court held he could not do that. You can only apply the clemency powers on an individualized basis. So we're taking a look at that, but as we have said all along, that's a cumbersome, lengthy process, and obviously this requires some speed. So we are looking at that, but at this time, again, we have to comply with recent case law in individualizing each one of those cases.
Thank you, Brian. So just to follow up on that point, for those who may be incarcerated and have long-term sentences, is there any special provision? Do you guys have any plans to help kind of stop the spread there? For those who are going to be in there for a long period of time.
Question being with those who are incarcerated and likely will continue to be incarcerated because of their sentence. DOC has been taking extraordinary measures, as I've mentioned. They're trying to create space so we can provide individualized care, space, quarantine, isolation for those prisoners. And we're doing everything we can with respect to the face guards, face masks that they've been making, and the shields. Everyone has them. 2 bars of soap per week. We're diligently abiding by CDC guidelines so that we can stop the spread in what is a confined space. So we definitely share the concern that this is, we're doing our very best, but we share the concern that this could be a dangerous situation. That's why we're adopting all these measures. So appreciate the question.
All right, the last question will be from Max Thornberry with the Northern Virginia Daily.
Hi, Governor. We have a list of essential businesses and a list of businesses that have been forced to close. There are some non-essential businesses that are still open. There's a lot of concern about how many people are caught in that non-essential but allowed to go to work net. What's it going to take in terms of numbers or figures for those non-essential businesses that haven't already been ordered to shut down?
The question is of non-essential businesses, and are they going to be shut down? And we have made it clear that bricks and mortar non-essential businesses, as long as they're able to maintain the 10 or less rule and to provide good cleansing of surfaces, that they're allowed to stay open. Again, if there are reports out there of people that are not complying, I would appreciate hearing of that. But we've made it clear that if a business cannot comply with the guidelines that we have set forward, then they must close. And so it's straightforward, and that's the policy that we outlined in the executive order, and that's what we're going to stand by now.
To that end, sir, you have told people not to only go outside for essential reasons, for needs, not wants, but if a business is not essential, what is the purpose of potentially going to there?
Well, I think, everybody, the question is, why would someone go to your question, a non-essential business? For example, someone may want to go pick up a book while they're staying at home, and if they go to a grocery store, get their supplies, or pharmacy, and they're out and they want to go by and pick up a book or whatever that will help them get through these difficult times, if that business is able to comply with those guidelines, we have allowed those businesses to remain open.
Thank you.
Thank you all for being here. Again, I encourage all Virginians to, if you have essential reasons to go outside of your house, to please use the mask. And there are websites where you can link up to give you directions on how to make those masks. And please continue to, and as difficult as it is, to maintain these guidelines, the social distancing, the frequent washing of your hands. And again, we will all, as a Commonwealth, get through this together. So thank you all.